many buttons. So many buttons.
Yeah.
It's very nice today. Have you had it done?
Sorry?
You had your hair done?
No, I just brushed it.
I love it.
Thank you is what I meant to say. Thank you.
Yeah, it's looking great. It's looking great. So how have you been? How's this week been? You got any ADHD examples to include?
I don't know. I feel like it's been a shit week.
Oh, Vix.
I've had my cough came back and I've been not very well, and I've had toothache, and I've just been really tired. And when it's just you just had one of those weeks that are just like, oh no, I'm done with this.
Oh, have you got your aches and pains sorted out, or is that still going?
Toothache. Yeah.
Man.
And I'm not even going to bother going to the dentist because, and actually maybe this is not an ADHD. Actually, maybe it is an ADHD related one. Also last week I had 3 days of the worst period pains, like crying on the floor. So let's turn this whole thing into a rant about doctors.
Okay, off you go.
Because I have spent 25 years trying to get my pain sorted and being dismissed at every single turn because doctors don't give a shit about women and women's health, and they don't know anything about women's bodies because they don't study it. And so I've just spent like 25 years being gaslit as, there's nothing wrong with you, it's not that painful, isn't it? Have you ever had anybody say, oh, it doesn't hurt, that doesn't hurt, that's not painful, and you just want to like throat punch them?
I haven't actually had that, but I think I probably would if I was in pain and somebody told me it's not that bad, because I'm not a baby, and I'm sure you aren't either.
No, and well, it's been bad enough before that I've had to stop Joe from calling an ambulance because he's been so terrified at the state that I was in, and I was like, don't call an ambulance because there's like nothing they can do. It's just anyway. So there's kind of all of that, and then I don't know what my toothache thing is. I've got like not impacted wisdom teeth, but I've just not got enough room in my mouth, and I've been back to the dentist with the same thing over and over again, and like every time they're like, oh no, it'll just happen every now and then, and I'm like, well, that's not good enough. It's like, can we not? And it's just like this whole thing about women's health, and we can like segue this background into the repeated misdiagnoses for women, which is why we get diagnosed so late with ADHD and autism and stuff like that, because they're just like, oh, you're just emotional, or you've just got anxiety and depression. And it's like, yes, I have got anxiety and depression, but that's a symptom of something else.
Right. Yes, exactly. Yeah. I remember being told at school when I was having panic attacks, you're just highly strung.
Highly strung, yeah. Oh my god, I'd forgotten those words, and as applied to me, yeah, I've been told I'm highly strung before. I'm too emotional.
Right. So what's the way forward then, Vix? What are you gonna do? Are you gonna get second opinions? Are you gonna?
No, I've had second and third opinions, and I'm fucking done with the fucking lot of them. this needs a swear warning on this one, because like I'm just so angry, and like, and if you take that I'm like a wealthy white woman, you can times this by like a fucking 100 for women of color, like,
right.
And so it's just yeah. So I don't really know what the answer is, other than because like our mental health services are so underfunded, and so there's years and years waiting lists for people waiting for ADHD and stuff diagnoses. So I don't really know what the answer is, and that's not a very helpful thing. I guess Tories out would be a good start because they are systematically destroying the NHS.
That's going to happen on Thursday, isn't it? Let's face it.
Party, man. But yeah, it's just, I guess, just kind of, write to your MP, tell your story. And I think that's probably the most powerful thing that people can do, is like make sure that your voice is heard, make sure that you're telling your story. Because I think there's a lot of stigma attached to, well, literally everything to do with mental health and stuff like that. But also, to do with ADHD diagnoses and autism diagnoses and things like that, because there's been so much publicity about it. There's so much absolute nonsense, negative publicity as well, where people going, oh, there's misdiagnosed, people are diagnosing themselves on the internet. It's like, yeah, they are, because there aren't enough services to help people. So I think if we can start like talking about it more, and kind of drowning out the voices of the armchair, the armchair people who are like, oh, this didn't happen in my day. And it's like, yes, it did happen in your day. It's just that, So
Yeah.
I don't know. What do you think the solution is?
Well, do you know what? It's quite interesting, because I'm feeling like I should offer this, that when I am fully qualified and properly trained, I don't just want to use you as a case study. Hypnotherapy has been found to be very powerful with pain relief.
Ooh, okay.
Yeah, it's studies have shown particularly good with IBS.
Oh.
And I was learning a technique which I haven't tried on anybody yet, but it's all about getting heat into your hand. So imagining heat into your hand and placing it onto the area that hurts, a little bit like holding a hot water bottle to your body.
Ooh.
And it sounds very, very simplistic, because the guy who was teaching us, he said he went to one of the leading experts in hypnotic pain relief, expecting that he would find out some really like key techniques that were different to anything else he'd learned. But actually a lot of the very, very standard hypnotic techniques were used in pain relief. And so it's actually something that isn't too difficult, but could be incredibly effective. So when I feel like I'm, or you can actually search this up yourself as well if you like. You don't have to wait for me to bloody train. But yeah, I mean, I'm actually fully aware of how powerful hypnotic pain relief is. I don't know if you ever saw my post about putting a needle through my arm.
No, I definitely would have remembered that.
Right. Yeah. So there is a post out that where I was actually doing some self hypnosis. Imagined my arm in a bucket of cold water, and also imagined it being numbed with anesthesia. So basically, I imagined that my arm was completely numb, and my tutor came along and passed a needle through my skin just here. And then I've got a picture of it. Do you know what? Right up until the point where he was putting the needle through my arm, I thought I was going to tell him, no, I'm not hypnotized enough. Stop it. I can't do this. It's going to fucking hurt, because I am a baby about needles. It takes me, I have to like psych myself up to get things like injections, because and blood tests. It's like, I hate needles. And this, it felt no more than just like a little pinch, I suppose. That's what it felt like. Just a little bit of a pinch. It's not, some people who were doing it with me said they couldn't feel anything at all.
Ooh.
And I was like, wow, this actually really does work. This using your mind as a factor in pain relief actually really does work.
That's
so
interesting, isn't it?
Yeah, I've got faith in it, but I'm sort of saying, like, I'd love to sort of like say to you, let's do it right now, but I feel like I need to go back and learn some more stuff, and then we can do it. But yeah, that studies have shown that it's really worked for people with IBS.
Well, they've done operations using hypnosis, haven't they?
Yeah.
And like people have like hypnobirthing is a thing as well, like giving birth. So I know it's a thing that can work. And when you think about as well what your body can do, in crisis as well, it's not the same as hypnosis, but like you can, if adrenaline will do it. You don't realize these people who have been shot or whatever, and they don't realize they've been shot until much later. So yeah, it makes perfect sense that you can train yourself to. That's really interesting. Maybe you should hypnotize me live on YouTube.
Well, yeah, let's give it a go. But seriously, that when I'm a little bit further down my studies, I'd be more than happy to do this with you, because my tutor was saying that there was a guy in his group that had 2 wisdom teeth extracted using hypnotic anesthesia.
Wow.
Just no pain, and he said it felt like having his teeth scooped out of ice cream. It's freaking bizarre.
You see, I think they would have to knock me out for that, not because of the pain, but because of the whole thing of it. It would be like no, it's just too weird and gross. But
Yeah.
no, I really like that. And do you know what? That's actually because I was thinking, how do we bring this back to ADHD again, and how do I stop being such a whiny little bitch? And because I'm very aware, because like normally we're kind of laughing and happy, and I was like, I've been very sad and angry this week, and it's just been like, and I think part of it has been, and this is why I love the idea of the hypnotherapy thing. It's like part of it has been just my lack of agency and everything. You know, it's like and I think this is a problem that a lot of people have in healthcare. It's like they just feel like they've got no agency, and they're being told what they think, what they feel, what they're experiencing by doctors who quite often don't have a clue about people's individual. I'm not saying they don't have a clue about medicine. Well,
yeah.
They don't, but but yeah, it's like people's lived experiences. You don't get to argue with that because it's like you don't. And I had another similar thing. And another thing, it's like I've got a really dodgy knee. I ripped the cruciate ligament and smashed my knee up when I was 20. So it's always been painful. It's getting more and more and more and more painful. And I went to the doctors a few months ago to get an X-ray, and I was like, it's not going to show up on an X-ray because it's soft tissue. And she's like, well, I can't refer you unless it shows something on an X-ray. And I'm like, do you have any idea how ridiculous that sounds? It's like, and she's just like, well, I can't see anything wrong. And I'm like, I know what's wrong. I've got the medical records from years ago. It's my knee. I understand what is wrong with me. I know I need a referral to, the orthopedic specialist. And she's like, oh, there's nothing I can do. And it was that lack of agency that was so frustrating. And I think that's quite a common thing as well when people are kind of going through any kind of diagnosis, and with the ADHD as well. It's like you're waiting on other people, and it's very disempowering. And so to be able to like hear you talk about hypnotherapy is really, really cool, because it's like, oh, what, I could take my own pain away without like taking 3 times as many ibuprofen as I'm supposed to take, which is not ideal. So that's really exciting.
Yeah, exactly. It is very exciting. And my tutor, he's written a book all about self-hypnosis. His name's Adam Eason, Eason. So look him up on YouTube. He's got a lot of stuff out there. He's been doing it for like decades. And what I love about his approach is that he's saying that hypnotherapy interventions should be short with the therapist, and that the ultimate game is to get people to self-hypnotize, to be able to look after themselves, so they're not always coming back to you for stuff all the time. And I love that. I love the fact that we're empowering people to really go and look after themselves, and to think that after a little bit of education about how to manage your own pain, that you'd be able to go away and put that into action. I love that.
Yeah, I think that's the key, isn't it? It's like empowering people to deal with their own pain, whatever that pain, whether it's physical pain or whatever mental pain. And like sometimes, of course, you need medication and that and interventions and stuff. But for stuff like that, though, it's really powerful. So, like, how do you think that we could apply that kind of thing to, I don't know, to the ADHD pains that that come with everyday life?
Well, do you know what when you say I don't know if the pain is related to ADHD, and I'm only guessing, but I think there could be some kind of psychological dimension where how we just hyper focus on stuff. And I knew going the other way, when you hyper focus on taking pain away, that seems to help. And I wonder if there is, and I certainly don't want to say, oh, it's all in your mind, but to actually follow that pain in your head and really believe that it's staying with you. I think that could have a factor in how intense it gets. Because I remember there were times when I was sent home from school because I couldn't cope with my period pains. It was like I was practically on the verge of vomiting because they were so bad. And it's like I wonder if that's sometimes what we do that's different to neurotypicals. Maybe. Is that we can actually follow and amplify and intensify a feeling of pain. I don't know. I'm only guessing on this. I've got no research for that, but
I don't know. It's difficult, isn't it? Because like I'm sure there is probably something in what you're saying. Because it's like it's really difficult not to focus on pain when it's there, especially when it's that acute. It's so painful that it takes over everything. And it's like, how do you not think about it? So like learning techniques to take yourself out of your body almost would be really, really useful. Because I mean, you said you didn't want to say it's all in your head, but literally everything is in our head. Everything's connected, right? So it's like that's where pain signals come from. That's where we experience, whatever it is. So
yeah,
it's really interesting.
it is really interesting. And do you know one of the cute things I learned about pain is that what you need is to hold Joe's hand if you're feeling very, very intensely in pain, because that has been shown to reduce pain signals, is to hold the hand of somebody who loves you. It actually can help, which is weird, isn't it? Yeah, they've done studies on this.
I mean, I suppose that makes sense, because it's like this when you think about this is one of my theories for why some of the more woo stuff works on people, that the placebo type stuff, because and Joe's talked about this before. It's like somebody is paying attention to you, somebody who cares about you and your outcomes is paying attention to you, and it almost doesn't matter whether you can kind of prove empirically and scientifically if it's actually working. It's the fact that if it makes you feel better, then that's not a bad thing. It's like it doesn't, and so I think that makes perfect sense, because like stuff like I'm going to enrage the woo people now, but like stuff like homeopathy, which is patently nonsense, like it physically can't work, it's just water, but it does have a placebo effect, and it's because you're paying attention to yourself, I think, and that's not a bad thing necessarily. It's only a bad thing when people start prescribing it to cure cancer and things like that, but I do think there's something in the whole, paying attention to yourself and that care and having somebody else pay attention to you that's really important.
Yeah, absolutely. I mean, placebo is big in hypnotherapy. It's not considered a dirty word or a cheat or an opt-out. It's like that's what you're aiming for.
Yeah.
So it's power. It's our minds are so freaking powerful.
Yeah, they really are. It's like who is it? Napoleon Hill said, whether you think you can or you can't, you're right. Somebody said that. I can't remember.
Somebody said that. I can't remember who. I'm not sure if it was Napoleon Hill, but it is an actual. It's a real thing. Yeah. And one of the things that we learn when we're sort of like learning self hypnosis is to learn to have confidence that our skill is building, because hypnosis is a skill. It's like something you learn and you get better at over time. It's not something that somebody does to you. You actually create everything inside yourself, but you just might be led by a hypnotherapist every now and again. So to have that confidence that your skill is growing. And you might think when you first start using hypnotic pain relief that perhaps it only made like a 5% difference, but to actually notice how that builds over time, it just makes you realize that you are actually learning a skill that you're helping yourself with. So let's sort of like get you on that journey of self-empowerment, because it sounds like relying on other people to help you get better is just causing you a lot of anger and frustration.
Yes, it is. And yes, and I still think like for other people who are not as, I don't know, privileged as me, it needs to change, like the way, and definitely the way we look at women's health needs to change. Like that absolutely gives me the rage. But I would, for me personally, and for people who are in a position to do so, I think it'd just be very cool to be able to take back some of that power and just be like, actually, I don't have to just sit here and wait for somebody to help me or wait for the system to get fixed. It's just like there is stuff you can do.
Yeah, exactly. This is what I love. So yeah, we'll talk more about that in the future, definitely.
Yeah.
And am I allowed to just change the subject completely, because
I was going to ask you to? Yeah.
I'm really interested, because I have just climbed Snowdon, and I saw a picture on your like blog thing about you like climbing over this ridge like that.
Yeah, that's Crib Goch. It's on the way to it's the ridge that goes from Nant Peris to Snowdon.
Fuck. that looked scary, man.
It's scary AF. I've done it once before, like, oh, it must be 15 years ago now, and I don't remember it being that scary. But then Joe was like, well, you used to climb 2 or 3 times a week back then, so it probably wasn't that scary. So yeah. But how is your Snowdon?
Do you know what? This is a perfect example to talk about ADHD, right? Because it was a night hike. Okay, we did the Lamberis path, which is actually the easiest one.
Yeah.
However, we were doing it at night, so it was going to be a challenge in terms of getting over feelings of sleepiness and just marching on through the night and not having any views to reward you with.
Yeah.
So it's just like a relentless trudge. And our group, we had about 100 people in our group, and it was divided into beginners and intermediate and advanced. Right, and I was put in the intermediate group, which I think was absolutely fine. I've done a fair bit of walking. We did the Swiss Alps last year, and however, I just thought, I'm 55, and I'm going to be walking at night, and therefore intermediate felt about right for me. The people in the advanced group were like professional personal trainers and that kind of thing, people who were very fit, and I was like, no, this is good. I feel good in the intermediate. Kev said, I'm going to do the advanced. I can walk, and he's a walking machine. He's actually really, really quite a bit faster than me when we're out on our trails, and he's a bit of a machine.
He's also like 4 feet taller than you as well. You've got to remember
he
that.
is he's over 6 foot. He's lanky. And so we were waiting in this hotel meeting room for quite a while, between sort of like 9 o'clock, and the groups didn't start setting off until 11:30. So the original group, the beginners, were going off at 11:30, and I was like, great, off the beginners go. I'm going to be going in half an hour. I missed my call for the intermediate group.
Of course you did.
I was like, where's the oh my god. So I was left with the advanced group.
What were you doing?
Just chatting to Kev, and just like staring around the room vacantly.
That was so funny.
Yeah, but I had a mild panic attack at that point, thinking, oh shit, and I thought, should I stay in the hotel? But the lady who was sort of like organizing it, Paul's wife, Leslie, said, don't worry, you'll be all right, because she'd seen me do a couple of other physical challenges, and she knew that I had like a general level of fitness that was all right. And it was like 10-15 minutes into the walk where I just thought, I'm gonna have to turn back. This is ridiculous. I was blowing out of my ass. Like we set off at a real pace. There's a really steep road that leads to the path, the Lamberis path that goes out of the village. I didn't realize quite how steep until we climbed down it in the daylight, but it was like that.
Yeah.
And I was like, oh shit, there's something really wrong. I felt sick. I felt shaky. I thought I was going to pass out, and I was like, I can't keep up. I need to turn back. But the guy, it was like special forces guys taking us up there. And he said, don't worry, just keep going. They are going way too fast. Then there's no way they're going to keep up this pace. It's like, so he radioed ahead saying, get these fuckers to slow down. He said, there's no way they're going to keep it up. And I was like, okay, I think I can keep going. Honestly, I was wanting to cry. I was holding Kev's hand, knowing that was a good thing to do to help me like stay around it. Kev was like, you're all right. And he was tugging me on.
Oh, bless you.
It's like probably about half an hour in, I was absolutely fine. I got into my stride, and my breathing had settled, and my heart had stopped bursting out of its chest. And I was like, I can finally do this. And we ended up making it all the way up in 3 hours, and we went back down in 2. And I looked on the what can you expect to climb Snowdon in, and the round trip was between 5 and 8 hours, depending on level of fitness on that path. So it was like, oh, good. I was at the top end of that.
Yeah.
But it was like, to begin with, I was fucking terrified, thinking, fuck my ADHD, I missed the call. And I was like, this is so bad. I'm going to die. But actually, it was all right. And I ended up feeling really proud of myself. And
yeah, you should.
We reached the summit so fast. We were up there by 3:30, and so it was pissing down the rain. It was foggy, so we never got to see the sunrise that we were planning to see the sunrise up on the summit, but we actually got up there too fast.
Oh, well done. That's amazing.
So are the views nice from the top of Snowdon?
They are magnificent. Yeah. You should totally do it again in the daylight because it's beautiful views. Yeah. And if you go up the miners path, that's a really nice route up. It's a little bit it's not as easy as the Clanveris path, but it's a really nice walk up, and you come back down by the lakes, which is really, really nice.
Oh, nice. So the miners path.
Miners
path. And I would love to do that. I would love to actually see it in the daytime. But it gets busy up there, doesn't it? I mean, we were coming down at about 4, between 4 and 5 a.m. and there were loads of people heading up.
It gets so crowded up there, and I'm always really torn because, like, on the one hand, I think it's great that it's accessible, that everybody can get up to the top of Snowdon.
Yeah.
On the other hand, you kind of like, I'm at the top of a mountain and there's like a bazillion people here, and it's not restful at all. It's not a restful thing to go up if that's what you're after. So
no, okay. So you go up there and you see the views, and you have to put up with the crowds. I'm not good with lots of people.
Me neither. No, I had a bit of a panic because I was like, Joe was like, oh, we'll go and get a cup of coffee and stuff from the place at the top, and it's just too much. So
is there a place? Because I hear there's a cafe. I couldn't see it because it was too foggy and rainy.
Yeah, there's like a massive cafe. There's a gift shop. There's a gift shop.
Oh my god!
A little bit, like, I got told off the other day by my friend for like saying it was a bit depressing with all the hordes of people, and she was like, I'm one of those hordes of people, and it's like, well, there's a gift shop at the top of the mountain. It's like peak capitalism,
It is. Yeah. Oh, I'm quite glad I didn't see that.
But the like, and that's like only one bit of it, because the rest of it, like the more difficult paths up, have obviously got far fewer people on, and the views are glorious. Like, it's such a beautiful part of the world. Yeah. So it's worth.
So nice.
Yeah.
Yeah. But so you were one of those nutters that actually does mountain climbing, like proper climbing.
It's not really mountain. It's a scramble. It's known as a scramble. I think it's like a grade 1 scramble, so not a difficult one. But there are moments on that ridge that are proper hair. Like, I had a couple of moments where I was like, I really don't like this, and a couple of like climbing moments. But even then, and like, part of the reason I didn't like it is there are a lot of people doing that path, which was interesting because hardly anybody does that path because it's dangerous. Like, if you go up in a really you wouldn't go up in rain or a really strong wind. Absolutely not. But then there were, like, on the day that we did it, there was this trail running race going on, and there were people literally sprinting across that ridge, and I was like, fuck. And so you'd move out of the way, and somebody had come hurtling past you, and it was like, oh my god. So yeah.
That is crazy, because even on the like the easy path, it's a sheer drop, isn't it, at various points? And they said, make sure that you've got your torch shining, because there is a sheer drop coming off these paths. Oh my god.
100%. Yeah, I think people, because it's Snowdon and it's very commercial, I think people forget it is actually a mountain. It's wild, and if you fall off, you will probably die. So
and it's like mad. It's mad, isn't it? But yeah, I'm glad I did it, and I will definitely go up there again just to see the views, because I bet they are fantastic. I mean, when the sun started to come up and we were about halfway down, it just looked gorgeous.
Yeah, it is gorgeous.
Yeah. So yeah, it was all about the achievement rather than the views, but it was still worth doing. But I was very interested to hear your experience, because it looked way more hairy than mine.
Well, I don't know. We didn't do it in the dark, so.
Oh, but it still looked like crazy stuff.
It was.
So, excellent. We've reached the end of the half an hour already, which is like, it flies by. And I'd suggest, Vix, that you start looking up self-hypnosis for pain relief and start exploring it. And I have total faith that you are going to feel much more in control of your pain symptoms.
Thank you very much for that. I will do. I'll add it to the massive list of things that I am trying to learn, but I will push it up.
Push it to the top, because if you can help yourself with that, then it's going to make everything else easier, isn't it?
Yeah, exactly. Thank you so much.
Rels. Okay, well, lovely to. I'll stop recording now, and we will